Chapter 27, Hematological and Lymphatic System Function, Assessment, and Therapeutic Measures. All right, for our learning outcomes, list the components of blood, list the components of the lymphatic system, describe how changes in the blood or lymph systems can manifest as disease processes, describe the sequence of events in the process of blood clotting. Identify data to collect when caring for a patient with a disorder of a hematological or lymphatic system. Identify laboratory and diagnostic studies that are used when evaluating the hematological and lymphatic systems. Plan nursing care for patients undergoing diagnostic tests of the hematological or lymphatic system. List common therapeutic measures used for patients with hematological and lymphatic disorders, and discuss the role of the licensed practical nurse or licensed vocational nurse in administering blood products. Okay, so your hematological system pretty much consists of your bone marrow and your blood and blood components. Bone marrow is important because it produces red blood cells, which is basically what oxygenates our body. Okay, so if somebody is experiencing anemia, most often it's from diet, as in like a lack of iron or folate or whatever. But sometimes, especially in the elderly or in the immunocompromised, it could be related to the bone marrow just not producing enough red blood cells for the body. So keep that in mind as we go through this chapter. The lymphatic system consists of lymph nodes, nodules, and lymph vessels. All right, so the blood consists of plasma, which is basically the water of the blood. It just is the medium that holds everything. It's important because it tells us somebody's fluid status. So if the plasma is low, that means everything is really thick and hard to maneuver in through all the vessels. So our hematocrit kind of gives us an idea what the plasma percentage is to the red blood cells and the rest of the blood content. Red blood cells, that is what tells us basically how much material we have to oxygenate our body. So if our red blood cell count is low, it's a situation, because is it going to progressively get lower? We need to find out what it's happening. Now, oftentimes, we're not going to have a high red blood cell count and a low hemoglobin. That's not how it works. Hemoglobin is attached to red blood cells. So if our red blood cell count is low, then it's going to coincide with our hemoglobin being low as well. White blood cells are, of course, our soldiers in our blood to keep us safe from infection or viruses or things of that nature. So if we're low on WBCs, it's going to indicate that we have immunocompromising. If we're high in WBCs, it means they're out to work and they are fighting infection. Okay. Platelets. Platelets are important because they kind of just wander around through our blood until there's a cut, or until they're kind of like the Coast Guard of our body. So they kind of hang out until there's a problem, like things are not going well or blood's escaping from somewhere. And they go to the areas of escape and create the net that holds the blood in temporarily until our clotting factors get there. So if our body doesn't have enough platelets to clot, the first mechanism of our clotting cascade is not there. Platelets are important in that fact because somebody can quite easily bleed out. In fact, there's parts of our body that constantly rely on platelets because they're so at risk for bleeding, like hemorrhoids, or mucous membranes are very sensitive to platelet function, because if we don't have enough platelets, we tend to bleed from those areas. Functions include transporting substances, regulating body temperature, pH, and fluid balance, and transporting cells that offer the body. Oh, that's not going to be convenient, is it? I don't know what that was, but you get an idea. All right, so our body is mostly made up. 55% of our blood is plasma, whereas the other 45% is the rest of it, right? Our red blood cells, leukocytes, and platelets. I just explained, but the main component of plasma is water. However, plasma also contains proteins, the main one being albumin. Nutrients, electrolytes, hormones, and gases. Plasma proteins play roles in blood clotting and immune system and the regulation of fluid volume. Plasma without clotting proteins, which occurs when the blood is allowed to clot and the solid portion is removed. It's called the serum. So WBCs, look at how small the amount of WBCs that we have in the rest of our blood. And platelets form a narrow buff-colored band. This is basically a blood that's been put on a spinner and separated. We also do this for things like cholesterol readings because after you spin the blood, the fat content will go to the top and they could tell how much cholesterol is in your blood based off of the amount of fat they scoop off of the top. But this is how they separate the components of the blood. Anyhow, 1% or less of the blood volume consists of white blood cells and platelets. And then the RBCs are the heaviest of the formed elements and sink to the bottom of the sample. They account for most of the forms of elements. This value is the percentage of cells in the sample of a blood is called a hematocrit. So the percentage of plasma to RBCs is kind of how we decide what a hematocrit is. So your blood cell formation, we have all blood cells can trace their beginnings to a specific time of bone marrow cell called a stem cell, also called a pluripotent stem cell. Stem cells are unspecialized cells that give rise to immature red blood cells, white blood cells, and platelet producing cells. So our stem cells originate, stem cells, they also, we find stem cells in certain areas. I know that amniotic blood from the amniotics from the placenta has stem cells in it. Typically, our bone marrow does have stem cells as well because it regenerates red blood cells every, how long? 30 days or every 3 months. Excuse me, it's every 3 months, every 90 days. But they are all different types of cells. For white blood cells especially, these progranulocytes can be basophils, eosinophils, and neutrophils. Lymphoblasts and monoblasts turn into monocytes and lymphocytes. So these right here, these blasts, are another word for immature blood cells. Okay, white or red, they are immature. Whereas the offspring of the stem cell divide further, ultimately becoming a mature blood cell, white blood cell, or platelet. Look at this little platelet right here. Okay, so the breakdown of the red blood cell, we have macrophages in the liver and spleen ingest and destroy old red blood cells. That's what becomes bilirubin. That's what becomes, if we can't get rid of them, if the liver isn't producing enough macrophages to break down the red blood cells, and they become bilirubin in the blood. I know it's a little bit more advanced than we need to go today, but just know whenever you see something like, why does somebody who has liver problems turn yellow? It's because they aren't making any macrophages to help break down those red blood cells. In the process of hemoglobin is broken down into two components of globulin and heme. Hold on just a sec. Okay, I'm back. Sorry for the interruption. Okay, so the breakdown of red blood cells, macrophages in the liver and spleen ingest and destroy all red blood cells. In the process, hemoglobin is broken down into its two components of globulin and hema, right? So hema turns in and it's broken down into iron and bilirubin, and then iron is transported to the bone marrow where it's used to create new hemoglobin, whereas bilirubin is excreted into the intestines as part of bile. Now, globin is further broken down into amino acids, and the amino acids are used as energy to create new proteins. There it is. Okay, so formation of a blood clot. So remember I told you like blood clots are randomly just wandering around in our blood supply, waiting for something to start leaking so they can paste themselves to the side together and hold basically a patch until the rest of the clotting factors get there and continue. Let's explain this in more of a scientific terminology, right? So both the intrinsic and extrinsic pathways result in the formation of factor X. This occurs in a single reaction in the intrinsic pathway, while in the intrinsic pathway, 4 different reactions are required to activate factor X. Either way, once factor X is activated, the formation of a blood clot follows a common pathway as shown here. So here you go. We have first prothrombin is activated. The end result of both the intrinsic and extrinsic and intrinsic pathways is the production of an enzyme called prothrombin. So once prothrombin is activated, it acts on the globulin called prothrombin factor 2, and then thrombin is converting it to the enzyme thrombin. Thrombin transforms the soluble plasma protein fibrinogen into fine threads of insoluble fibrin. There you go. So the sticky fibrin threads forms a web at the site of the injury, and then red blood cells and platelets following through the web, become ensnared, creating a clot of fibrin. Blood cells and platelets, a blood clot can effectively seal breaks into the smaller vessels. However, blood clotting alone may not stop a hemorrhage from a large blood vessel. So this is a case you cut your finger or maybe a small injury of the skin, but if it was a large, massive hole, or if you need, basically the reason why we need stitches and why we need staples or whatever is to approximate the skin so that they can actually get clotted. You know, if something doesn't stop bleeding, that's a good sign it probably needs stitches. Lymphatic system consists of lymph nodes and nodules, lymph vessels, spleen, and thymus. The functions include returning tissue fluid to maintain bloody. Well, doggone it, how am I supposed to get this somewhere else? Let me see this. Okay. To maintain blood volume, protecting the body against pathogens and other foreign materials. There we go. So here's our lymphatic system, right? Our tonsils are part of our lymphatic system. It's basically, these are all, it's a whole system that's dedicated to our immune system, okay? It isn't our immune system per se, but it's dedicated. It basically has these little trap areas where WBCs can find the areas that the infection, go to it and exonerate it before it goes into our circulatory system. And that's kind of what the purpose of the lymphatic system is. That's why we have swollen lymph nodes. That's why cancer loves our lymph area, because it helps them travel all over the body undetected, because cancer doesn't look like infection. So it, it'll go through our lymph system and travel all over quite easily. Sometimes it gets trapped there. So, aging changes. The aging hematologic and lymphatic system is less efficient immune response, iron deficiency, slowed erythrocyte production, reduced plasma volume, increased risk for infection. So because they have a less of immune response, they're going to be at an increased risk for infection. Because they have iron deficiency and slowed erythrocyte production, they're going to be at risk for anemia. And because they have reduced plasma volume, they're at an increased risk for dehydration. So a health history needs to be taken. So reason for seeking care. Why are you here? What are your signs and symptoms? What's your family history? Do you have any, does infection run into your family? Some people are just more infectious than other. I don't know what it is. But they're more susceptible to infections. Like I know a whole family that has to go get immunoglobulin infusions every couple months or so because they're just generally their immune system is really bad. Diet history, medications, occupational exposures, fatigue, bleeding tendencies, respiratory symptoms, skin changes, and any lymphadenopathy. So do you have any swollen lymph nodes? Now, let me tell you, people, whenever we think of swollen lymph nodes, we always think of the ones up here. But if you were to cut your arm and it were to become infectious, you could get swollen lymph nodes in the arm, in the axilla. You can get them in the growing area. We can get them. I mean, you can pretty much get a swollen lymph node anywhere. Those are the most common areas, and but lymph nodes are throughout our entire body. So our physical assessment, we want to get vital signs, assess the level of conscious, skin color, signs of bleeding, lymph nodes, fingernails, and the abdomen. Our diagnostic tests, we're going to get blood tests, coagulation tests, bone marrow biopsies, lymphoangiographies, and lymph node biopsies. And, we remember cancer likes to hang out in the lymph nodes as well. So blood products, packed red blood cells, or PRBs, we like to use we order them in units. It's very common, and whenever we very rarely infuse whole blood. Whenever somebody's getting blood, it's usually packed red blood cells, because when somebody's getting blood, they don't need plasma. They don't need the platelets. They don't need any of that other stuff. We just need red blood cells because red blood cells is what oxygenates. So, I mean, they may need platelets, but if they do, then we want to give them a concentrated form of it. Just like if somebody needs red blood cells, we want to give them concentrated amounts of red blood cells. If somebody needs platelets, we want to give them a concentrated amount of platelets. We don't want to give them just a little bit that would be in the whole blood. It's not as effective. Does that make sense? So platelets, albumin, fresh frozen plasma, and cryoprecipitate. So just know for transfusion safety steps, always we're going to assess the patient. We really, really need to identify the patient. Take the time to sit down with two nurses to verify that that's the right patient. We want to use at least 3 identifiers: their name, their date of birth, their medical record number. You also want to match the blood type. You also want to make sure that the blood bank number is accurate and the unit number on the blood matches the patient's band. Because as soon as somebody gets a type and cross screen ordered, the blood bank comes up to the patient and puts a wristband on them, and that is their blood wristband. That's going to tell us this is the right one to give. Okay, and if there's any problem with anything. And also take a visual look at the actual blood. Like, make sure there's no opening. Somebody tried to tape it, it became, that is a contaminated. I mean, we're talking blood here. Blood is nasty. It's like bacteria love blood. And so if it's been compromised at all, it's going to be instantly putting your patient into shock, okay? Because they are going to be infected. So that is something that needs to be really looked at closely. Like, you visualize, make sure there's no openings, make sure there's no somebody tried to tape it shut because it accidentally got poked or something. I don't know, but I've seen some stuff, and if it's at all questionable, don't do it. Okay? Use only normal saline when on the same line as blood. You want to use a blood filter line. I'm talking about IV line. There is special Y set tubing that we use for administering blood, and it has a really big filter. Washing and warming. If you're giving mass amounts of blood, it is really important that you warm the blood first before administering, because you could put the patient in hypothermia. Okay. Now, transfusion complications can include febrile reactions, urticarial reactions, hemolytic reactions, and all these reactions are going to happen within the first 10 minutes of administering blood. So guess what? You, as the nurse, are going to spend the first 15 minutes that blood is being administered to your patient with your patient. So as soon as you see anything that may resemble, especially a hemolytic reaction, because that's the one that kills you, you could stop the transfusion. Just stop the transfusion. Okay? Don't start the saline because you don't want to push what's in the line into the patient. Just stop it, call the doctor, and see what kind of things. Oftentimes, when you call the doctor for non-important um, blood reactions, they'll just order Benadryl and Tylenol and continue the infusion. But if there are definite signs of which transfusion reactions look like: severe back pain, I can't breathe, I'm sweating, shaking, something's wrong. If those start happening, stop it and talk to the doctor and tell them that you think you might be having a hemolytic reaction. And that is, like I said, that is a medical emergency. All right, so which cells form platelets? We have reticulocytes, progranulocytes, monoblasts, and megakaryocytes. I think it's megakaryocytes. Yes. Okay. What is a normal WBC count per millimeter? Now, I know I don't, it's this one, right? 4,500 to 11,000. What is the function of a spleen? Select all that apply. It stores platelets, it produces clotting factors, it removes old RBCs from circulation, it stores bile. I know it doesn't store bile. It contains lymphocytes and macrophages. Yes, it does. And those remove. I think it's 3 and 5. It might be 1 too, though, but I know it's 3 and 5. The spleen doesn't produce clotting factors. The liver does that. So let's see. 1, 3, and 5. Let me go back, because I guess it doesn't let you go back. What was 1? Hold on. Oh, wow. Let's move on. Which term is used to describe pinpoint bleeding into the skin? And that would be number 4, petechiae. Petechiae is whenever somebody is taking, like they're on Coumadin, little tiny hemorrhages happen in the skin. They look like little bruises, but it's just like purple flecks on the skin. And which IV solution must be used with blood transfusion to prevent complications? Remember, it's always normal saline that can be used with blood transfusions.